So, a little background about what we call the epidemiology, or how many people are getting diagnosed with this, and who are the people getting diagnosed with this. In the year 2025, we estimate that about 67,000 people, men and women, will have a new diagnosis of pancreatic cancer. Sounds like a lot, but it's actually a rare cancer in general. It's probably, if you look at many different resources, the eighth, ninth, or 10th most common cancer in the United States. But if you contrast that to a more common type of cancer like breast or lung or colon cancer, in 2025, the incidence or the number of new diagnoses of breast cancer will be about 317,000. So 317,000 men and women diagnosed with breast cancer compared to 67,000 diagnosed with pancreatic cancer. You can see it's quite rare. In fact, pancreatic cancer only accounts for about 3% of all new cancer diagnoses in the United States in general, and almost 8 to 10% of the people that pass away from pancreatic cancer, or cancers in general, 8 to 10% of those are pancreatic cancer. But what I wanted to highlight is that the rate of diagnosis is increasing. It's very unfortunate, but at about 1% per year, these numbers are going up. So on the very top part of the slide, I listed that there are 67,000 patients in the United States that may be diagnosed with this diagnosis this year. But in 2014, just 10, 11 years ago, there was only 46,000 Americans diagnosed with pancreatic cancer. So the numbers are growing, and that's not just in the US. Globally, this is probably the 12th most common cause of cancer, and there's about 500,000 or a half a million people in the entire world diagnosed with this cancer. Just goes to show that there's a lot of work that needs to be done when people have this type of cancer. And a lot is changing, and there's a lot of advancements. But the reason why is because this is such an aggressive disease, and there's so many people that have this diagnosis.